Okay, so this morning's webinar is to share with our employer group benefits administrators some information that we hope is going to be a benefit to you since the benefits 24/7 system went live on January the 16th. But please do keep in mind that as we're presenting this morning, that we have received a lot of reported issues as well as suggestions on how to improve the system. But we won't be covering a lot of those today, and that's just because we don't really have all of the fixes yet. But please be assured that our team really is diligently working on all of the reported items that do need to be fixed. So, like I explained to our other group yesterday that I was presenting to, the best way to really let you know how we're going about tackling these fixes is to kind of compare it to the triage process of a medical emergency room. So, as your tickets are being received and issues are being reported, our team is assessing each one of them to determine which one needs to be dealt with first, and they are basing that on a whole different variety of criteria. However, just know that we will get to them all, and we do continue to please ask your patients. We ask your patients to just be patient with us. We do appreciate and want your suggestions for improvements to the system, so please continue to send those in through the HCA support portal when you have them, because once we do get the system up and running pretty well, then those are going to be some of the areas where we will be able to spend some time improving the system. So with that, I will be the main presenter today. My name is Debbie Crumples, and I also have with me with my teammate Larry Cade, who is in the background, and he'll be answering questions as you submit them throughout the webinar. And he will also jump in when I need him to clarify or answer some things as I go through the presentation. So here's what we plan to cover today. So we're going to provide some additional clarification on how to access the live benefits 24/7 system for both benefits administrators as well as your employees. We're going to cover the updated or new process on how to submit your requests to add or remove BAs with admin access to the benefits 24/7 system. We're going to provide some new information about the special open enrollment and dependent verification tiles. And then there's going to be a section where we cover several other important items that didn't fall into any one specific category, but will be helpful for you to be aware of. And then, like always, we will provide resources for you and your employees as you continue to learn and navigate the system that we hope are going to streamline your learning process. And then finally, we will open it up for your questions and answer as many of them as we can within the time we have allotted for today's webinar. Okay, so let's go ahead and start with some additional information on accessing the live benefits 24/7 environment for you as a benefits administrator and employees. So first, we just want to say, please be sure that you're logging into the live environment and not the training environment. And we're only sharing this because we really have had a few BAs logging into the training environment to do their live work. And when they're doing that in the training environment, that's never going to show up in the live environment. So we just want to be sure that everyone is using the live environment URL to get signed into the system. And this will also apply to your employees when they're trying to log into their employee or subscriber account. However, for Pierce County and Yakima County employees, your employees won't be using Benefits 24/7 to make their benefits elections or changes. They're just going to continue to use Workday. And like we shared in our pre-launch webinar, here are ways to also access that live environment. So first, through the icon that is located on the blue navigation bar that's at the bottom of the PEBBA website, and also through the green button that used to say PEB My Account, but it's now going to say Benefits 24/7. But here is another quick way to get to the live environment. And again, this is going to be from any of our HCA web pages. So at the very top of the web page, you can click on that login option where it's going to provide a drop-down box, and then you can select Benefits 24/7 from there. So we do bring this up because Larry and I both have been working with several benefits administrators, and we've had to have them share their screen with us so that we could help troubleshoot their login issues. And we've been seeing that a lot of you are going through a lot of clicks just to get to the login page. So this is what I do to get to that login page as quickly as possible because like you, I am in the system a lot. So I've gone ahead and bookmarked the live environment URL webpage, which allows me to get to it with only one click. And how I did that was to click on the star icon that's to the far right of my Google screen when I had the live environment webpage up. Okay, so in this next section, we're going to share with you the new way to add or remove benefits administrators with that admin level access and benefits 24/7. So just like before, you're still going to need to make your request by creating a ticket through the HCA support portal, and then you're going to click on that benefits administrators only option. And now you're going to see that you have only one option to choose from, and that's the benefits administrator inquiry option. And then this is going to be the screen that comes up. And you're going to select that your inquiry is PEB related. Then you're going to select yes, that your ticket is related to benefits 24/7. And then it's going to give you that drop down box to choose what your request relates to. And now you're going to see a new option to add or remove admin access. Then it's going to ask you to select which one do you want to do. Do you want to add or remove this person? And then it's going to provide these boxes here where you can give us the BA's information. And then once you submit it, our team will go ahead and make those changes for you. Okay, so now we're going to move on to some things that you'll want to be aware of as they relate to the special open enrollment and dependent verification tiles. So we're going to go ahead and start with the special open enrollment event verification tile, which shows up on your BA dashboard. And in this example, I'm going to zoom in on this tile so that you can see the BA has 0 SOE event requests. However, when you actually click on that SOE verification tile, here's what you're going to see. So in this example, this employer actually has 3 verifications that are in draft status. But remember that these 3 verifications did not show up in the count that was on the dashboard where it showed 0 requests for your review. So this can be misleading if you're only going to go into the tile when you see that you have some requests that are ready for your review. So what we're going to recommend is that you go ahead and go into this tile on some kind of regular basis, even though it might show that you have 0 requests for your review. And here's why, because if you have any special open enrollment events that are in that draft status, they're going to stay on this pending request page like they are here until you actually do something with them. So for example, if I click on the first employee in this example and pull up their draft SOE, here's what's going to come up. So as you can see, this employee has submitted documents that show proof of their SOE event. But then this little narrative here, it's indicating that the subscriber did not submit their SOE event. And then they're telling you as the BA to go ahead and work with that employee to go ahead and complete and submit their SOE event. Here, it's also telling you that that subscriber did not make any new elections based on this SOE event and to assist them with completing their elections or to go ahead and deny the request or the event. And in order to review that, you would need to go to the subscribers draft SOE event. And how you do this is to go into their subscribers account and click on their special open enrollment tab. And then you can scroll down to see their draft SOE event. Then all you would have to do is click the box that's next to the event, and then it's going to go ahead and allow you to click on that edit option to review their request. So just remember that when you are trying to figure out why this SOE event is in draft status, that could be for a variety of different reasons. And in most cases, you will need to be reaching out to your employee to gather more information. But once you've clicked the SOE edit option under the employee's account, that's going to let you walk through this SOE wizard so that you can double check what your employee's done. And it really could be very simple and be that they did everything right, but until they got to their last screen in this wizard, which tells them that they're all done. So at that point, a lot of employees are just going to go ahead and sign out because they think, oh, yeah, I'm all done. But it does go on to tell your employee to click on the submit button. It's just that our employees don't generally read that far down. So if they didn't click that submit button, then it's never going to show as a pending event for you to review in that number count that shows up on your BA dashboard. So let's say that once you've researched this employee's SOE event, that really it is just a draft. It was done by mistake or it was done wrong. Then in order to get it off of your pending page, to remove it, you would have to go in and cancel that draft request. And how you do that is again to pull up your employee's account and again under their SOE tab, click that box next to the draft SOE. And then this time you can click on the option to cancel the SOE event. Okay, so now moving on to the dependent verification tile, which also shows up on your BA dashboard. And here's the screen that's going to show up when you click on that dependent verification tile. So as you can see in this instance, this BA has two pending verifications and they look to be a little bit outdated or maybe outdated. So we just wanted to bring this to your attention because we have been seeing some of these come over through the migration process. And we just want to be sure that you're checking them out to figure out why they're showing up as pending and then decide what you would like to do with them. Because again, if you don't do anything with them, they're going to continue to be included in the number count on your dependent verification tile that does show up on your BA dashboard. And this is a really important reminder that you please first review and approve or verify your SOE events that are under that SOE tile, and then review and verify the DV documents that are ready for your review under your dependent verification tile. And this is just because that when an SOE is to add a dependent to your employee's coverage, the dependent information is not going to show up on that dependent verification tile until you have verified that associated SOE event. Okay, so here's the section where I'm going to cover a lot of different topics that we've learned about since our go live date on January 16th. So I'll try to go slow because they're going to be different. So the first one is we have been getting a lot of questions from our BAs about how long you can be in the benefits 24/7 system before it's going to time you out or log you out. And the answer to that is the system will time out after 20 minutes of your not having any activity in benefits 24/7. Okay, so this one is not going to apply to you if prior to our go live date, HCA used to key all of your employees' information for you. But if you did use to key into Pay One, it will apply to you. So for entries that you used to make on the A23 screen in the Pay One system, you will now need to submit this information to us through an HCA support ticket. And when you open your ticket, you're going to click on that box that says no, that it's not related to the Benefits 24/7 system because it's not. It's not a Benefits 24/7 issue. Then you're going to, from the next drop-down box, you're going to select that accounting option. And then it's going to bring up a box where you can provide the adjustment amount and whether that's a debit or credit adjustment, as well as the name and social security number of your employee off of your reconciliation report that we should be applying that adjustment to. And then once you submit that ticket, it will be routed to our accounting unit and they can make these adjustments for you. If you are trying to add a new subscriber who is currently enrolled in PEBB retiree or continuation coverage, you are going to get a message like this letting you know that this individual is enrolled in retiree or continuation coverage, and that if you add them into your PEBB employee coverage, the system is automatically going to defer their retiree coverage or terminate their continuation coverage. And then it's going to offer you that purple claim button that you're used to. But we're going to ask you to please do not claim this individual. Because if you do, it's really going to kind of mess with their retiree or continuation coverage and any dependents that they have enrolled and any automatic payments that they have set up for that coverage, for premiums for that coverage. So instead, we are going to ask you to please cancel that entry in benefits 24/7 and to go ahead and send us an HCA support ticket letting us know that you would like to enroll them in PEB employee coverage. And then once we get their retiree or continuation coverage unenrolled, on our side, we'll let you know so that you can add and claim them as a new PEB employee subscriber. And this is just a little more information about your entering your employee's date of eligibility. So first, just remember that the date of eligibility is going to be entered on the first screen after you click the option to add a new subscriber. And I think this is where some of our BAs are running into trouble because on this screen, they're entering the date of eligibility as the employee's effective date and coverage. And if you were someone who used to key into pay one, you were used to entering two dates in the system, one for the eligibility date and one for the coverage effective date. But with the rollout of benefits 24/7, you now only need to enter the date of eligibility because that date is going to carry over to this page where you can input the employee's demographics information, or that data will already be there because you claimed them. And then the system is going to automatically determine and populate that coverage effective date. So this is where we really want to tell you to kind of stop and take a really close look at that coverage effective date to make sure that it's correct. Because if it's not, then that's really going to be your first clue that the date of eligibility that you entered on that previous screen is incorrect. And if that ends up being the case, you would just want to cancel out of this and start over and add them with the correct date of eligibility. But in this example, we're going to say that you do have the correct date of eligibility and the correct coverage effective date. Then once you've added all of the employee's information and clicked on the submit button, and then go back to your BA dashboard to search for and manage that employee, you're going to see that you can no longer see the employee's coverage effective date, that all you're going to be able to see now is their date of eligibility. So it's really important that you're entering the correct eligibility date and then verifying that the system determined the correct coverage effective date before you go ahead and submit and save that employee. And because you can't see the employee's coverage effective date after you have saved them, then we just wanted to show you another way to find that information. So from your BA dashboard, if you click on the history tile and then you do a search for that employee, here's the screen that's going to come up. And then under the subscriber eligibility option is where you can find the effective date of coverage. So when it comes to terming or ending your employee's eligibility for PEB benefits, please just remember that the date to enter in the termination effective date field is going to be the employee's last day of work or the last date that they were in pay status. And then the system is going to automatically determine the employee's benefits ending date. So what we have been running into is that we have some BAs who are entering a termination date of like 3/1/2024 because they think that the system's asking for when does that employee's PEB benefits, when are they no longer active? And when they're entering March 1 in this field, then the system is automatically entering the employee's benefits end date as March 31st. And this is resulting in a lot of tickets coming to us so that we can correct these dates. Okay, so here's another one that we wanted to provide some additional clarification about. And I am just going to say right up front, if I don't get this right, Larry, please jump in and help me clarify this because I know we got a lot of questions yesterday. So just know though, this is not going to apply to any of our medical only groups. So the MetLife enrollment process has not changed from the process that was in place prior to Benefits 24/7 going live. So what this means is that your newly eligible employees must still complete the paper forms and submit those directly to MetLife. So I was trying to explain that this continues to be the case because MetLife doesn't enter your newly eligible employee information in their portal until usually after your employee's 31-day window has closed. And because some of your employees might want to apply for that supplemental life insurance within that 31-day window without having to provide evidence of good health, then if they wait to apply for this supplemental coverage using the online portal, they could run into some problems with missing that 31-day window of opportunity. And then once your employees are outside that 31-day eligibility window, they can certainly log into their their employee benefits 24/7 account and go ahead and link to the MetLife portal to apply for supplemental life or AD&D insurance, or they can also log into the portal to update their beneficiary information. So I think some of the confusion was that some of you only give your employees the beneficiary paper form because in order to enroll in the basic MetLife, they don't need to do the enrollment form. So if they didn't want to do the supplemental life, that's fine. They could just do the beneficiary the way that you're doing it now. Okay, so this one is definitely an update since the pre-launch webinar. So previously, we did share with you that there would be no data coming over into your organization profile tile and that you would just need to go in and add your organization's contact information. So that didn't exactly end up being the case. What we have learned is that contacts did come over from one of our HCA contact databases. So now instead, we're going to ask that you please go into this tile for your organization and make changes as needed. So if you need to add contact information, you can do so by clicking on the Add Contact button. And if you need to remove or make changes to an existing contact, all you need to do is click that plus sign that is next to their name and either update their information or click on the option to remove them as a contact from your organization. And we have been getting some questions from some BAs about learning or understanding which wizards that they can expect to see in the Benefits 24/7 system. So there are 4 different wizards, and the first one, which most of you are already familiar with, is the newly eligible wizard. And this wizard is going to show up on your employee's dashboard after you've added them as a new subscriber with their date of eligibility to your organization in Benefits 24/7. So this is going to include brand new subscribers that have never been a subscriber in PEB benefits and for employees that were previously enrolled in PEB benefits. However, there has been a break in their PEB coverage, which makes them newly eligible. Also note that this wizard will not show up on the employee's dashboard until their actual date of eligibility. So if you're a BA who enters your newly eligible employees prior to their date of eligibility, just because you like to get them into the system, then just don't be surprised when you don't see the newly eligible wizard. And this is just because your newly eligible employees cannot access that wizard to make any benefit elections until their actual date of eligibility. So the next wizard that you can expect to see from time to time is the transfer event wizard. And this wizard is only going to show up on your employee's dashboard after you've added them as a new subscriber with their date of eligibility to your organization. And when they were previously enrolled in PEB benefits with a PEB covered medical only employer, and they're not incurring a break in their PEB coverage. So that's only if you are full benefits with PEB. If you're a medical to medical, then you won't see it. So then with this wizard, it's going to allow your employees to go ahead and enroll in one of the PEB dental plans. It's also going to allow them to make their employee paid long-term disability plan elections. And this wizard will also allow your employees to add dependents to their PEB dental plan. However, this wizard will not allow your employees to make changes to their medical plan or add or remove dependents to or from their PEB medical. The next wizard is the special open enrollment event wizard, which is going to show up when you, as the benefits administrator or your employee, enters a special open enrollment event from the employee special open enrollment tab or tile. So as you can see, the wizard does look a little bit different than the other wizards. that you're used to seeing, because with this wizard, you aren't going to be seeing that blue chevron that comes up with the other wizards. Instead, once the event type is entered with the event date, it's just going to pop you into this SOE wizard. And then at the top of the wizard is where you can see what I call the wizard's path, where that blue dot is going to show you where you are at within that SOE wizard process. And then finally, the last wizard is the open enrollment wizard. And this wizard is going to show up on your employee's dashboard each year during the open enrollment window, November 1 through November 30th. And really, at this time, we don't have any more to share about this wizard because we will be learning more about it, all of its functionality, and then sharing that as we get closer to the open enrollment period later this fall. And in case you were not already aware of this, just know that the PEB enrollment change forms are going to only be available on the PEBB website. So if you are an employer who has decided to not yet direct your employees to their online Benefits 24/7 employee account to make their benefit enrollments or changes, or if you are directing them to their online account, but your employees prefer to use the paper forms, then just know that you, as their benefits administrator, are going to be the one who needs to provide these forms to them. Also, for your newly eligible employees, this information about how to get paper forms is also provided in the employee enrollment guide. And if you would like to place an order for a supply of these forms and enrollment guides in hard copy format, you certainly can do so by going out to the PEBB website, and under the forms and publications page, you can click on the order materials option in that blue box. And then just click on PEB that's up in the upper left corner. And then here's where you can place your order for the guide and forms. And for our medical only groups, just be sure that you're clicking on the form for medical only. Okay, so for the next several slides, I really just wanted to share with you some filtering features that might make it a little bit easier for you to find information that you're looking for within the Benefits 24/7 system. So here is a screenshot after clicking on your Manage Subscribers tile, where let's say you've done a search for your employees, looking for all the employees who contain the letter A. So I know this screenshot isn't the greatest example for this, but let's say that your search results ended up with a large number of hits. Well, then you could just click the header at the top on any one of these columns. And in this example, I chose to click on the last name column. And as you can see, when I did that, it's going to sort those search results by last name, which can make it easier for you to find a specific employee. There's also this little filter feature, and when you click on it, like I did here under the first name column, it's going to bring up a box where you can enter some criteria to search on. So in this example, I wanted to search for first names that contain the letters A, R, T. And then when I click on the filter option, it's going to further refine those search results to show only the first names containing the letters A, R, and T. And then as you can see, the filter here is green, which just tells you that you do have a filter on this column. And when you click on it, it brings that box up again where you can click on the clear option, where it removes all of your filter and search criteria and brings back all of your original search results. So just know that these filtering options are available on most of the pages within the Benefits 24/7 application. Okay, so before we go ahead and open it up to your questions, here are some resources when you or your employees need help with the Benefits 24/7 system. So for you as benefits administrators, you can send us your questions through the HCA support portal. And we would like to ask that please be sure you're sending your issues and questions through the portal and not to our outreach and training staff, because a lot of our team is receiving large volumes of emails directly from benefits administrators. And this only slows down our response time because then we're having to redirect you back to the portal because that's where the various issues are being tracked and managed. So we do know that this gets frustrating for all of you because it is taking a long time to hear back from us, but we are working through the tickets as quickly as we can. And when you do submit your tickets, if the issue is related to a specific employee, then please be sure to include the employee's name and social security number, because this will make it easier for our team to take a look at that situation and troubleshoot it for that employee more specifically. You can also refer to the Benefits 24/7 FAQs that are located at the bottom of the Administering PEB and Benefits 24/7 webpage. You can refer to the Benefits 24/7 manuals and training videos that are out on the PEBBA website, and also be on the lookout for Gov delivery messages from us that alert you to any updates as they relate to the Benefits 24/7 system. And for your employees, please don't hesitate to refer them to the PEB employee website. Remind them that there will be some information coming out in their February for your benefit newsletter, and to refer to that quick start guide that was sent to them back on January the 23rd. And for your newly eligible employees, refer them to the enrollment guide, because that guide does contain some really good instructions on how to log into their employee account in the system. And finally, you as their BA are always going to be their main point of contact. So if you aren't able to answer their questions, then please go ahead, reach out to us, and we will get answers for you so that you can get answers back to your employees. Okay, so that does cover our post-launch of the Benefits 24/7 system webinar. So now I'm going to go ahead and open it up to Larry, see where we're at with your questions and if there's anything you need my help with.
This is a couple questions we got to do a little bit of research for, and I'm just answering the last one we have here. If there's other questions, just let us know. Deb, can you hear me?
Yeah, I can hear you.
Okay.
And it doesn't really look like, it looks like these two are for you, Larry. I'll let you take that last one too. Well, I can answer that one. I'll just
Which one?
answer that one.
Which
For
one?
Michelle, she
Okay.
said that she submitted a ticket. So if you've submitted a ticket and we still have not addressed it, she's asking, what can or should I do? Here's what I would like to say. If it's something that's, that far out and it's related to an employee specifically, go ahead and email Larry and I, because we don't want employee issues hung up. But she's right. If you go back to a ticket that we have not responded to yet and you say, hey, what's the status of that? That ticketing system looks at the last time you touched that ticket as the most recent date, and it moves your ticket all the way to the bottom. So I would say if it's not something that's employee related and you can hold tight, I would wait. Otherwise, go ahead and reach out to Larry and I for those employee specifics, but give them a chance on the employee specifics even. Otherwise, our inbox gets inundated. And if it's an issue that relates to a lot of employees, we're not able to work on what the real issue is if we're just working on one employee at a time. Okay. How do I put in an end date for an employee who is no longer active? So if the employee is losing eligibility, you would just go to their eligibility tab, and you scroll down, there's options there for terming their eligibility.
Hey, that one too is that you can only process special enrollments the day of effective date. You can't do it before.
Let me read this. For SOE changes and verifications, I tried to process a change end of January for an effective date of 2/1, unable to process until 1/2/1. Is there no way to process SOE changes prior to effective date? So when you put the event date in, here's how it's supposed to work. When you put the event date in, then the effective date, there's an override thing there, I think. I'm not sure. I'd like to work with you on that one just to kind of watch your screen. I'll check your email and get back to you on that one, because I would like to see exactly what you're talking about so that I can also get some additional training. I'll reach out to you. Changes to salaries for currently enrolled employees. Can we manually make those changes for long-term disability purposes? Yes. If you are an employer who is entering salaries for your employees because your data does not feed over, and that's going to be most of you in this group, or you are manually putting that stuff in. Anytime you have a salary change for your employees, you do want to be updating that because that impacts their long-term disability employee paid premium if they're enrolled in that employee paid coverage. Angie, please send that one in as a ticket. I'd be curious why you're not able to update a last name. That seems like it should be working, but please send that in as a ticket. For term date, yes, please use the last day worked or last day that they were in pay status. And the benefit ending date will automatically populate based on that. For Stephanie, when your employees are not completing the PEBB enrollment form within 31 days or going into their newly eligible wizard and doing that enrollment within 31 days, on day 32, it is supposed to be defaulting to the default plans. So Nadine, on your employee, you put in a ticket. Again, on this one, I would be happy to work with you. I'll have your email. I'll look at these afterwards just to see what the process, another learning thing for me. So I'll reach out to you on that one. Do you see this one, Larry, from the anonymous attendee? Best time
Hey,
frame
who is
to
that?
yeah, we're curious like how you have an anonymous
We only know who you
attendee.
are.
We can never get back to you. If you sign in that way and we want to go back to our questions and we want to get back to you specifically, we can't because we don't see your name and we don't see your email. So we don't know how people are getting in like that, but it would be helpful if you want us to be able to answer you. So maybe you could send us your email in this Q&A and then we could help you. But best time to update a salary in the system for LTD. For me, it feels like as salaries change,
Well, no, they
that's
have
the
to do it
best time.
before. Right now, currently, it's before the coverage, the salary change is effective. So they don't have the effective date there corrected yet. But once they
Oh,
enter the date effective date in there, then they can enter past salary effective date. So for currently right now, if you have a salary that's effective 3/1, you can enter it now and it'll go in effect. But if it's 1/1, we can't do backdating at this point. We know it's a fix. We know something that they're looking at. They're looking to correct that in the future.
perfect. Thank you. Do you see that one on the Cobra packet, Larry? Termaine
Cobra.
is from the
Who is
anonymous.
anonymous? Man, who is this? It's hard for us. We can't answer you if we don't know who you are. You answer all these questions.
Yeah, and how do you change an address? We're sorry, we don't know your organization because it could be different, right? Most of you are going to go into the eligibility and change them, but it depends which employer you are. Does the system automatically know when an employee is enrolled in Medicare? We don't track that information, do we, Larry, unless you're enrolled in retiree coverage, correct? Do we
Which one's
track
that
the
one?
Medicare? It's Ashley Huffman. She says, does the system automatically know when an employee is enrolled in Medicare? So if an employee is in Medicare A, would we
Yeah.
know that? Okay.
So the system automatically enrolls you in Medicare Part A as an active employee, but
Mhm.
as a retiree, they have to prove it, and the system will actually update it. Will update it for the retirees. But for an active employee, it'll automatically enroll them in Part A when they turn 65.
Okay, perfect. Thank you. Joanne, thoughts of having a video recording of the login process. Um, there are videos out there for the login process, out on the BA training
Is she
page.
talking about employees or employers?
Oh, good question, because we don't have one for employees. Again, this anonymous attendee on the new baby. Once we know who you are and your agency, we can probably help you further. Do we have a responsibility to keep copies of proof of dependency? If you are a BA who has those DV documents in your hand and you're verifying like that, what you do with those documents would matter. I guess that's based on what your agency policy is. And there's always those records retention requirements sent by the Secretary of State that your agency has to follow. But as far as we don't determine that. If it's in the system, then you don't need to worry about it. We have our own programmers who are maintaining those documents for X amount of time. And then if you're keeping hard copies, whatever your agency says.
Yeah, we shred ours. So I mean, once we have them, we see them, we shred them or give it back to the employee.
Yeah. Oh, thank you, Rita. She says there's a box that allows you to send questions anonymously. Not helpful for us, though, because we can't really identify how to help you.
I'm
Okay,
not sure
thank
why they
you.
would. I don't know why they would check that box unless they don't want people to know who you are. We're gonna find you.
um, okay, so Veronica, one of us will work with you on that one. We'll do that because we don't want you to be held up. Um, I don't know, Jodine. So do we just submit an HCA ticket for the effective date? Maybe need a little more clarification. Any options for additional reports? At this time, I would say if you are interested in requesting other reports than are on the reports tile, please send that in as an HCA support ticket. That would be an enhancement. And here's what I would tell you. Tell them what you want specifically, right? Kind of create the query. Here's the columns I want. Here's the information I want, and in brief. Why is it important? And I think that could very much help. As far as building or querying your own reports, I don't know that there are any tools for that right now. Maybe add that as a suggestion as well. Spousal surcharges. Jessica, yeah, when we work with you, I'll be happy to go over that with you. You have an employee, Carmen, employee coming back, rehire. Did you have a question on that? I don't see any more than that. Jodine, when updating salaries, the cents only go to the 10th. I was not aware of that. You're not putting like a period in, right? So if you're trying to put like $5,000.23, you would not put a period. You would just put 500023, and then when you tab to the next field, it would show the full cents. So try that. If it's not working, that should be working. I would send that in as a ticket. Okay. Again, Donna, we'll work with you on this one.
There's a few like that there, so
Yeah. Okay, we'll work on these.
see, Joanne's
Employee.
is an employee's one.
I forget what her
Remember the video?
question
It's the
was.
video, the
Oh,
video
yes,
for
yes, yes.
login.
Please send that as an enhancement request. We are getting a lot of requests for that. Keep sending it. The more, I feel like the more hits they get for the same enhancement request, maybe, right? So send them in if you want that. uh, Okay, so for Angie, how do you update salary information for staff? Okay, so I can't go in and show you guys this because if I open up one organization's information, then I'm sharing it with everyone. And this is personal information that we can't share with everyone. But if you go in under the Manage Your Associated Subscriber, you pull that employee up, you go Ability tab, there should be a salary there where you can make a change and then go ahead and submit and save that.
Yeah, there's not a date for you to put there right now, but
Right.
they are working on that. So hopefully in the future, whenever they get to it, there should be a date in there to make sure the effective date of the salary is out there. But right now, just all you can do is change the salary.
Here's one, Robin. If I entered my first employee in 24/7 and they did not show up on the statement, should we send a note to accounting? Absolutely. And I
Well,
would say
hold
that,
on,
oh,
hold
oh,
on,
oh, sorry. Yeah.
hold on. It just depends on when they enter it. So they enter it after cutoff, it won't show up on that invoice. They'll show up on the next invoice. So it just depends on when they entered it on the statement. I mean, and in their 24/7. So if it's
Okay,
after the
perfect.
cutoff, I have to wait till the next invoice for it to show up. So it
Okay.
may not be an issue. It just may mean you entered it after the statement was also already processed.
Okay. Thank you for that clarification. We have someone with an employment ending date of 12/15 last year, still showing active in 24/7. I wonder when that was keyed, but if you have a ticket
Yeah, but
in
it's an
there,
anonymous, right?
we need your
Hey,
information. We can't really help you.
I
Yeah,
think an
sorry.
anonymous doesn't work. You gotta let us know who you are. What if it's the same person? Why would
Yeah,
you do
maybe.
that?
Yeah, I don't understand why people do that. Maybe they have their reasons. Okay. Claudia, if you have salary changes that need to be backdated, do those need to be submitted as a ticket,
Yes, a ticket.
Larry?
Yeah,
For
our
now.
customer service that has to go in and make adjustments in pay one. Yeah, so yes,
Okay.
submit those as a ticket.
Jessica, the reporting functions that you asked for, not specifically at this time, please go ahead and submit those as a ticket for an enhancement request. I don't think I understand what the comment here is from Randy, but that's maybe we'll look into that one later. Yes, it has been a long, bumpy road. Things will settle. They will. We have great faith that, when you launch something like this so big and impacted so many people, we have a great group of developers who are working feverishly, and but I'm sure it's been that way for you too. So thank you everyone for your patience as well. We will get there. It's a nice system once they get some of these kinks worked out. Let's see.
So
Veronica, they on that Molina, that wouldn't they qualify for an SOE if they lost eligibility for other coverage
yeah, so if they
during the year?
lost, yes, they would have the ability
It
to
would
do
be
a
an
special
SOE,
enrollment.
yeah.
But it's only 60-day window though, so it's something that's a 60-day window to enroll. So it has to be within the last 60 days.
Is there a confirmation that they can print for an employee when we term them or make any changes? The confirmation actually, as far as terming them, I think wouldn't it show on the statement of insurance,
Yeah, we think.
Larry?
Yeah,
Yeah, I would
that's what
think
I would
so.
use.
And again, in making any changes, because when you're making changes and you're doing it through the wizard, or because that's usually the only time you can do it, at the end, it gives you that option to go ahead and download the election so that you could kind of see what was being done. During open enrollment in November, do employees make all changes or does the BA still have to make changes to dependents? No, the employee should be able to. Again, we don't have all of these specifics about that, but yeah, the employees will be able to do most of what they need to do. We will definitely know more and provide training on that more extensively down the road. Okay, so Savannah, I have issues with updating spousal tobacco attestations. Not able to attest that they no longer use tobacco. Is this something I'm missing? Um, if it's, I want to make sure it's tobacco just on the spouse, right? And you're not trying to change the spousal premium coverage surcharge, but that's something that it might be a little trickier on the tobacco. I would like to maybe work with you to like watch what you're doing and kind of make sure that we're doing. I'll get back to you. Yes, Larry, he has great energy. He's awesome. We would be lost without Larry. He rocks. Yeah, I second, third, 150th that. Um, is this time also for feedback? If you have feedback like on the like suggestions or things that you would like to see be improved for the benefits 24/7, please submit that as a ticket. And it would be, there is a place there for feedback. You can choose that as one of the options for benefits 24/7. Oh boy. Sharing our email addresses. Oh boy, please, we don't mind sharing our email addresses. We just ask that um, if it's something that you know is going to hold up your employees' coverage and you need help because people aren't getting back to you, we're happy to work on those. But if you have something in general, please, as much as possible, submit that through the HCA support portal because that's where they're also, if they track them, they can see if there's a programming issue. And so if Larry and I are over here fixing them all, the programming part will never get fixed. So we will do that. We will share our emails with you. Um, Larry, I don't, you can put yours in the chat. I guess I can do that too. Yes, if you have an employee who's coming back, rehire. So rehire to me means they have had a break in their coverage. They're already in the system. Yes, all you need to do is add them as a new subscriber with a new eligibility date. And the system should recognize that they are available to re-enroll. So yeah, you should be able to get them with no problem. Oh, Angie, you submitted a new subscriber. So you added a new subscriber. Will I get a request for dependent documentation? I don't see where I can upload birth certificates, married. Okay, so when you're in the wizard, if you're doing this for your employee, and you're adding a dependent, there's going to be a page that says you can upload documents right there. So that's where you can do it. If you need training on that, please go ahead and submit a ticket. Anne Marie, do new employees receive an email from HCA with login information when we set them up in benefits 24/7? No. Once you set your employees up in benefits 24/7, if you're directing them to go ahead and do the enrollments themselves, that is your organization's responsibility, how you would like to educate them, make them aware of how to use the system. So nothing from us. Oh, Larry's answering this one about the date of birth thing. Yes, the webinar will be posted on the BA website. Probably not today, but I would say in the next, check in the next few days. It'll be available for you to review. Yes, I agree, Ashley. Will you send that in, that confirmation email as an enhancement? The more of those they get, maybe they would do that. Oh boy, Claudia. Oh, that's funny. Um, Oh, okay. So Angie, when entering a new subscriber, there is a question that says, is this employee represented? Do you know if they're represented by a union? That's at this point, we're basically telling people to put no there because if you say yes, it's going to ask for the date. That is not information that we are using for any reason right now. It's just a field that might be used later. So if you say no right now, no worries. If you say yes, it's going to ask you which date, and then it's going to be up to you what you want to put there. It drives nothing. Jennifer, you have an employee that you've hired from another county. The system won't let you claim them. You might be, it might not be able to be claimed. Does it say something about they're already enrolled? How about we reach out to you and see if we can help you on that one?
Yep.
Um, that's narrated books. That's funny. Um, oh, okay. So where do you submit tickets for training? Same place, HCA support portal. And when you get there, you'll say yes to benefits 24/7. And in that drop down box, there is an option to ask for training. And again, if you want training, kind of be specific about what areas you'd like training. Do you want it Zoom, Teams, or do you want it in person?
Well, that other one to ask too, that do they have any training for employees though? Was another part of the question.
Yeah, as far as employees, no, not at this time. Yeah, that agency by agency, people are, you guys are having to figure that out. Again, I would ask for that though, if it's something that you want from HCA. And this error has occurred. Sorry, I'm not tracking that one because I don't remember who's asking what. Okay, it looks like most of our questions have been answered. If we were not able to answer yours, it's because you're anonymous and we need more information. Um, Yeah. And some of these, we're just not able to answer. So, um, Larry, did you put your email in the,
No, you said you were going to do it, but I can do it if you want me to.
yeah, just a minute. Let me go out here. Well, here's the funny weird thing. Oh, I guess I just go here in the Q&A and enter it. How do I enter my email? Wow. How do I submit that? I don't know.
How about we can just email them, as a group.
Okay, that's great.
Yeah, we'll email you as a group to our contact information.
Okay. Okay, so if there are no additional questions, it looks like we can give you back a little bit of your time. And thank you everyone for attending today. Have a good
Thank
rest of
you.
your day.
Appreciate it.